Today we'll discuss two long answers question, that is explain in detail about Lefort 3 fracture, and the second is Lefort 3 fracture, explain its fracture line, signs and symptoms and management. So coming to Lefort 3 fracture, it is also known as transverse fracture, craniofacial dysfunction, disjunction and suprazygomatic fracture. It is mainly caused due to force from the lateral direction in severe form. So coming to the Lefort 3 fracture line, it is transverse fracture. So the line, it starts at the frontonasal suture, then it runs horizontally to separate the frontomaxillary suture. Then it runs over the lacrimal bone, lamina propria of the ethmoid bone, and it runs towards the optic foramen. Fracture line goes around the optic foramen to reach the medial boundary of the inferior orbital fissure, where the line divides into two lines. So the one line passes around the frontozygomatic suture to separate the zygomatic bone from the frontal bone, and the other line, it passes posteriorly to fracture the pterygoid plates at the root, separating them from the cranial base. So in this diagram, we can see how the Lefort 3 fracture line approaches, or and here we can see whole of the maxillary bone, or it is separated from the cranial base. So it is also known as craniofacial disjunction. So coming to the signs and symptoms of Lefort 3 fracture line, first is periorbital edema and ecchymosis, that is swelling and puffiness around the eye, and also discoloration of skin is due to bleeding underneath. Also there is subconjunctival hemorrhage and ecchymosis. There is bilateral or unilateral. There is bleeding underneath the conjunctiva, and ecchymosis is edema of the conjunctiva. Then dish facies, as we have seen in the diagram, and the concave facial profile, and due to these three features we see dish facies appearance. Then hooding of the eye. Hooding of eye is seen due to separation of frontozygomatic suture, which causes loss of support to the sustamen. Then Raccoon eyes. Raccoon eye appearance is due to periorbital edema and ecchymosis. Class 3 malocclusion is seen with anterior open bite. Then there is mobility of the entire midfacial skeleton, and this mobility is due to craniofacial disjunction. Decreased mouth opening due to zygoma impinging the coronoid process and severe posterior gagging. Then CSF rhinorrhea with classical rail tracts. And what is CSF rhinorrhea? It is leakage of the CSF through nose after the fracture of cribriform plate of the ethmoid bone, and this feature can be seen in Lefort 2 and Lefort 3 fractures. And the test for the diagnosis of CSF rhinorrhea are ring test, beta transferrin isoenzyme test, and some bedside tests are handkerchief test, reserve also the Queen-Dash test. So coming to the next clinical feature, that is massive edema of the face. Then there is saddle nose deformity. In ophthalmos, it is posterior displacement of the eyeball. Then diplopia, that is double vision. Then hypoglobus, that is inferior placement of the globe in orbit. Then there is posterior nasal bleed or pharyngeal bleed, that is bleeding in the pharyngeal area. So coming to the investigations for Lefort 3 fracture, that is lateral radiograph, then soft tissue, lateral imaging, CT scan, MRI, intraoral occlusal radiograph, and posterior-anterior view. So management. Two phases of management, there is emergency treatment and definitive treatment. In emergency treatment, there will be soft tissue repair, access to the general condition of the patient, checking for the occlusion. Then in initial management, there will be ABC, what we have studied in general surgery, airway maintenance, breathing and ventilation, control of hemorrhage, checking for the degree of consciousness of the patient, and cervical spine stabilization. Then coming to a definitive treatment. So basic principles are reduction, fixation, and immobilization. Then in reduction, reduction is restoration of the fractured fragments to their original anatomical position. It can be closed reduction or open reduction. Now closed reduction, reduction is done by manipulation using Rose disinfection forceps. Then reduction by traction, there is internal suspension alone is not effective, so external suspension is also needed to help in internal suspension to work out. So external suspension is carried out through craniomaxillary suspension using the hollow frame or chick wires or universal rods and joints. So open reduction involves surgical reduction. So surgical approaches are bicoronal or hemicoronal approach. Now indications of these bicoronal and hemicoronal approaches are Lefort 3 fracture and Lefort 2 fracture. Now this technique provides complete degloving of the entire frontal area. Then the next approach is midfacial degloving. Now indications of this approach are Lefort 1, 2, 3 combined fractures. As we can see in the diagram, the incision is given in the wide it is a wide labiovestibular incision, and this approach allows access to the anterior surface of the maxilla, infraorbital rim, body of zygoma, and the nasal septum. Then transconjunctival or subciliary approach, it is the lower eyelid approach, and it is indicated in Lefort 2 and Lefort 3 fractures. So advantage of this approach is it avoids any second approach, and it facilitates the orbital floor. Then coming to transantral approach. Now indications of this approach are orbital floor fracture in Lefort 2 and Lefort 3, and it is used for stabilizing the orbital blowout fracture by packing maxillary antrum, and this facilitates the antral surface of orbital floor. Then lateral eyebrow approach. Now indications of this approach are for lateral or bilateral rim fracture in Lefort 3. Then the next approach is nasoantral approach, and this technique allows introduction of instruments into the maxillary sinus. Then when Lefort 3 fracture occur in isolation, then the management includes semi-rigid fixation at frontozygomatic suture, frontonasal suture, orbital floor reconstruction, zygomatico-maxillary buttress, zygomatic arch, and maintaining the occlusion. Now, next principle of definitive management is fixation. So fixation is the fractured fragments are fixed to their anatomical position to prevent displacement and to achieve proper approximation. Now methods of fixation are transosseous wiring and mini plate fixation at frontonasal suture, zygomatico-maxillary buttress, frontozygomatic suture, and infraorbital rim. Now this is 4-point fixation, but sometimes 3-point fixation is also sufficient. So here we can see the 4-point fixation at frontozygomatic suture, frontonasal suture, orbital floor, and zygomatico-maxillary buttress area. Now, intermaxillary fixation. This fixation is done to maintain occlusion. Then suspension wiring is also used. Circumzygomatic, zygomatic, and infraorbital suspension wirings are used, and support is given through antral pack and antral balloon. Now coming to complications of Lefort 3 fracture management. So complications can be immediate complications and late complications. In immediate complications, there is airway breathing ventilation mismanagement, then nasal hemorrhage, inaccurate reduction or insecure fixation, and in late complications, there is non-union, malocclusion, facial asymmetry, and cranial nerve dysfunction. Thank you.